specializing in existing and emerging risks. So let's talk about one of the existing risks. We just talked about at the Life Care Center in Kirkland, Washington State. 31 positive cases. You have an elderly population, 19 deaths linked to the nursing home. Talk to us about the risk for people who are older.
Yeah, and in fact, it just came out. The U.S. government yesterday in a press conference that Tony Fauci presented to the American public and the global public was that the average global age of fatality associated with COVID-19 is 80. And so that really makes it clear where our priorities need to be in terms of combating this disease outbreak. And so we are living in real-time information right now. It's a rapidly evolving story. And what is happening that's unique with this virus outbreak is that we're getting information. By we, I mean experts that are working in this space, epidemiologists that are on the ground, medical doctors who are trying to best reassure their patients and ensure that they are taking proactive measures to also protect those healthcare workers on the front lines. All the information is coming at the same time to all the different stakeholders involved in this. Usually with an infectious disease outbreak and diseases generally, it tends to be behind the scenes and there's more time to kind of understand and get the information out there consistently. But the lack of that, because of how rapidly this is evolving, is resulting in all of this uncertainty and confusion. So it's no surprise that you have communities of people that aren't sure what to do themselves and why the resources haven't been allocated according to where they need to be prioritized. But we now know confidently that it's towards older demographics.
And we've been covering this since December when it first appeared in Wuhan. One of the things you see with this COVID-19 is people don't have symptoms. And, you know, you think of nursing homes, the close proximity of the workers working with somebody, then moving and working with another elderly individual, it can spread like wildfire. And we also see with the cruise ship, that's sort of a petri dish as well. Talk to us about some of the concerns there.
Right, and it's totally fair to take precautions given that we healthy communities and groups of people may not show any symptoms but could be carrying the disease and then interacting with those communities that are more vulnerable, especially in nursing homes, especially in hospital settings. And that's where it's really critical to make sure that those people, after those who are showing symptoms, are tested next. And so because of budget cuts and for other various resource reasons, we didn't have the testing kits that we needed to prioritize. But now that these kits are rolling out, we'll be able to better test those who are potentially carrying the virus but are asymptomatic, and that overall we'll see is going to roll out across the population and just create a safer environment for those that are most vulnerable and those that are interacting with those that are most vulnerable.
Let's talk about taking this seriously, because I was supposed to MC an event in Los Angeles in February that was canceled in January out of the abundance of caution. At another event I was going to moderate in March, canceled in January out of an abundance of caution by the organizers. And then we have CPAC with these lawmakers there, and already we have 5 who are self-quarantining themselves. There seems to be, with the administration and some lawmakers, kind of a laissez-faire attitude about this.
Right, and so there is an appropriate amount of action to take to mitigate against a risk, whatever it is, whether we're talking about an infectious disease outbreak or impacts related to climate change. There are real risks, base rate statistics of the actuality that that risk is going to impact us, not just our health, but socio and economically, and we need to react appropriately. And so extreme containment measures are appropriate, and we've seen them work in China. We're seeing them in real time now in Italy. Is that going to be what's right for the United States? It's going to vary across countries. There's different cultural practices in place. There's different expectations, and there's different tolerance for what the public can be exposed to in terms of risk, what they're willing to accept. Right. For that reason, it takes a lot of collaboration to understand what is the best move in the United States.